The fascia, like everything else in your body, undergoes changes as you age. The first changes as you age are actually strengthening that because you are born with a very weak fascial system. Your bones are hardly ossified, the joints are not fully developed. It takes a year for you to have the strength and coordination to be able to stand up and use the fascial system in the way that you'll use it for the rest of your life. A fertilized ovum is almost 98% water. A newborn baby is about 90% water. Most folks are somewhere between 67–72% water, 2/3 and 3/4 water. However, that's slowly drying out as you get older. You could say that the process of getting older is a process of drying out, and the process of hydration is really, really important to the youth of fascia. So as you get older and the fascia dries out, it begins to fray or stiffen. So most of us at about age 48 experience that our arms get shorter. We have to start holding the menus out here because the fascia, the connective tissue inside the iris of the eye, is losing its elasticity, so we can no longer accommodate our focal length the way we could before. These lines of character, I like to call them, forming around my eyes are the fascia in my face breaking down. People tried injecting collagen into the face to take those kinds of things out. I prefer to let it dry out at its normal rate. However, you can drink a lot of water, but drinking a lot of water will help you see the insides of a lot of bathrooms and will have lots of good effects in terms of your vascular system. But in terms of your fascial system, you have to get that water out to the tissues. So movement is really important to that. If you don't move the body, you're not going to get the water out into the tissues where it needs to be. That's number one. Number two, that movement needs to vary. If you keep doing the same movements, you're going to keep sending the water to the same place. So by doing unusual movements, by rolling yourself out with a roller, by getting body work in unusual and stiff places, you're going to rehydrate those tissues that have become dehydrated by the course of your life. But the third thing that is really important in here, and that a lot of people who are doing personal training because they're really going to get there, is that rest is how the tissues rehydrate. When you do heavy exercise, you're driving the water out of the tissue in the same way that if you step on a wet beach, you push the water out of the sand, right? And it pushes away, and then you pick up your foot, and the water rushes back into that sand, or seeps back into that sand anyway. But you're doing the same thing with tissues. When you're really working out a tissue, you're squeezing the water out of that tendon, out of the fascia, out of the muscle, out of whatever joint tissues were strained by the work that you're doing. So people talk about 5 minutes every 25 minutes. It really depends on your level of training and your own genetics as to what the rhythm should be. But the rhythm should include some rest. You are predisposing yourself towards fascial injury if you do not allow the tissues to rehydrate by taking the strain off of them. And when you take the strain off of them, like a sponge, they will suck up that water and be ready for more exercise.